Good afternoon. I'm Caroline Sandoval with the Hayward Area Historical Society. This program is presented in partnership with the Women's Ministry of Palmacia Baptist Church and the Eden Rose chapter of Links Incorporated. We would like to thank you for joining us and welcome you to Black Health and Wellness Yesterday, Today, and Tomorrow. It is my honor to introduce you to this afternoon's MC, Hayward City Council Member Angela Andrews.
Hello, Caroline. Hello, everyone. Thank you all for joining us today for the Black Health and Wellness Yesterday, Today, and Tomorrow webinar here. And I am so excited to be here today. It's very important for us to come in and check in with each other, making sure we're doing what we need to do to get through this pandemic and to have these highly esteemed experts here. Experts here is a great opportunity for us to ask questions and hear some guidance from a variety of backgrounds on how they're addressing the pandemic. So the first person I would like to introduce is Dr. William Spivey. He is a mental health professional and director of a small group practice located in the heart of the medical district in Oakland. He offers more than 25 years experience working with anxiety, depression, PTSD, and OCD within adults and adolescents. He takes a holistic approach by integrating concerns of health, diet, and exercise. And he also works with those who are suffering from occupational diseases, including job stress, feeling stale on the job, burnout, and job unhappiness. Other areas of endeavors include reshaping, motivation, and marital enhancement. He consults with many Bay Area agencies and businesses, from foster care to substance abuse to evaluating managers from top businesses. He has assisted in setting up small businesses. The clinic, Family and Child Counseling Center, offers services by other providers, including an on-staff licensed psychiatrist. Thank you, Dr. Spivey, for joining us today. The next person I would like to introduce is Teresa Cox. You can join us, Ms. Cox. She is the first African-American ever to be elected to Fremont City Council in almost 65 years. Teresa is the first African-American elected to the Ohlone Community College Board of Trustees in 50 years and served 12 years as vice chair. Teresa is the first African-American woman who graduated with a degree in nuclear engineering in the United States of America. Her name is listed on 4 academic buildings on Ohlone College and 2 for the city of Fremont's Downtown Center and Age and Wellness Center. In a career that has spanned disciplines as broad as engineering, supply chain, and contract management, Silicon Valley, White House, Wall Street, Facebook, former Stanford Hospital board member for neonatal care, and now an executive for the County of Santa Clara Procurement Department as the Senior Strategic Sourcing Officer, where she was deployed as a frontline worker during the COVID-19 pandemic. She is the chair of the Legislative Affairs for Oakland Bay Area chapter of the Links, Inc., a lifetime member of Alpha Kappa Alpha Sorority, Inc., and a board member of East Bay Community Energy, to name a few. She is a proud member of 2 beautiful children, a son and a daughter. So thank you so much, Ms. Cox, for joining us today. All right. Yes. And the next person I'm going to invite on the panel is L.K. Monroe from Alameda County Superintendent of Schools. Since taking the office in January 2015, Superintendent Monroe has worked to position the ACOE as a model of social justice in action. At a time of tremendous change in public education, including drastic shifts in funding, standards, testing, and accountability, LK holds a compelling vision for the agency. She is committed to equipping the most vulnerable students and those who serve them with the tools to successfully make their way to, in, and through our public schools. Her approach builds on the rich assets of the county's diverse community, aligned with the best efforts of many different agencies, organizations, and individuals to pursue a strong vision of high quality education, including mental and physical well-being for all of our youth. As the Chief Administrative Chief Administrator for the Alameda County Office of Education, Superintendent Monroe works collaboratively with educators, policymakers, and business and community leaders to ensure that schools and classrooms are places where students thrive. Working closely with local districts, the superintendent's office convenes statewide work to implement systems thinking and collective impact processes. These processes are critical stages to forward ACOE's significant investments in early childhood education and pathways to college and career, supporting student successes and engagement in school, work, and their communities into the future. She is a committed advocate for the very best educational outcomes for our students. Her extensive experience as an educational leader and administrator includes serving as the Bay Area liaison for A Better Chance, a founder of the nonprofit Educational Technology Training Institute, a teacher, school improvement grant coordinator, and an award-winning principal in Oakland schools, director of academics for Seneca Center, an associate superintendent of education for Alameda County. LK holds a degree in public administration from USC. I also went to USC. Teaching credential from Holy Names University, and her administrative credential from the National New Leaders Educational Leadership Program. She resides in Oakland and has 2 adult children. I don't believe that. I don't believe you have 2 adult children.
30 and 34.
All right. Well, she's also going to share her fountains of both Teresa Cox and LK Monroe share their secrets of fountains of youth on this panel as well. So thank you. Thank you all for joining. I'm going to start off with Dr. Spivey. Can you speak about some of the mental health issues you have seen come to surface since the pandemic has started?
Well, yes, I can. Let me preface this by saying that even before the pandemic, African Americans of all age ranges have had some very serious difficulties with mental health to begin with. I mean, we have poor access to mental health services. The mental health services that are out there are not that easy to get to. One is access, 2 is affordability. We don't always get the best mental health services because of the affordability. The best mental health therapists are expensive. And those that we end up getting oftentimes are interns, residents, and so forth that are passing through. Oftentimes they're at clinics that are funded, and it's an opportunity for the residents and the interns to get some experience. So they're experimenting on us essentially. Now there's nothing wrong with that. We've all had to do it, including myself. I've had to do it myself. So, but in terms of when we approach serious mental health difficulties, it is really a problem sometimes because a lot of the organizations such as Kaiser, they're overwhelmed. The hospitals are overwhelmed. People in private practice are overwhelmed. It is really difficult. That was even before COVID. Now you top that off with COVID, and what you have is the underlying issue of not having sufficient mental health services available to the African Americans. And now you have a pandemic which is restricting so many of us, which is adding additional worry, stress, and what have you on the African American community. So yes, it is. So I just want to make that premise clear because we just think that, this pandemic has caused us a lot of mental health issues, but even before the pandemic, we had issues. And now this has complicated it. A lot of people that I see right now, in the beginning, I started off just seeing just regular people. When I say regular people, I just mean people with sundry mental health issues. Then you add on to that the fact that people are so restricted. We get information almost every other week about what we should and what we shouldn't do. Let me give you an example of a mother who has 3 kids, who's been told she can't go to work. The kids can't go to school. She has no help. Her mom maybe is a substance abuser. She's in an apartment. a 2-bedroom apartment by herself. Now, it's enough that if you just take away the pandemic, she got issues. But if you add the pandemic, now she can't go anywhere. She's sequestered in her home. And now she has to decide what the heck is she going to do. That adds additional issues, additional problems. Now, I've seen women like this. And what they're telling me is, what am I supposed to do? I'm depressed. I would be depressed. They're anxious because you got 3 kids running around and climbing on your lap saying, mommy, mommy, mommy. You can't go outside. You can't go to the store without mask. And even if you had a mask on, you're going to do with your 3 kids. And so I just use that as an example because that struck me so much. And I shared that with my wife about what in the heck is this lady supposed to do? So yes, I don't know if you want me to do the whole message right now, but I wanted to point those things out as simply an example of how mental health issues have sprung forth so vehemently during this COVID-19 era.
Right. And just when you mentioned the 3 kids, just even putting on a mask on a toddler or managing putting on a mask on a kid can add more anxiety and stress. And I can see that also being a challenge for a single parent. So you mentioned stress in your response. Is there another issue that stands out more than others that you're seeing as a result of the pandemic?
Well, we have a new term now in the DSM-5. That's the new diagnostic manual. And it talks about stress being the result of just being overwhelmed. Mm-hmm. It actually now is a diagnosis that we can give people. Stress can be exhibited in terms of anxiety. In other words, having too many decisions to make and not enough resources available to you to make those decisions. Stress can mean being depressed, obligations that you know that it's going to take an enormous amount of effort, but yet you don't have the tools and capabilities. So oftentimes, the less experience you have at the conditions in which you are in, the more stress it is going to cause. If you have experience dealing with issues and you have experience dealing with controversy, the chances are you're going to be more equipped to deal with things, which creates less stress, less anxiety. Stress is exhibited in terms of worry, poor sleep, poor appetite, bad decisions, poor decisions, and just the feelings of inadequacy. Stress can be also exhibited medically in terms of headaches, backaches, problems with your back, your neck, your trapezius, stomach issues, such as indigestion. It goes on. And we all now know that stress is a significant contributor to any medical condition you may have. I've had patients who've lost their life because I couldn't get them to stop being stressed. And they had medical issues such as cancer, which I kept telling them, you need to get on top of your stress because this is going to take you out. And sure enough, it did. So we really have to be aware of stress. And I know stress is a very commonly used term that a lot of people don't fully understand. But understanding that it can create medical problems, it can create problems that are going to take medical diagnosis and treatment to cover. If you don't understand it, you certainly understand that. So It is a very important term. I deal quite a bit with it, particularly now during the COVID-19 pandemic. I see nurses that are stressed. Just think about you're a nurse, and for a year and a half, you've dealt on the emergency ward or the critical care ward, and all these people that you're seeing have the potential of having COVID and having possibly dying. And so you're dealing with this all the time. And not only that, you're seeing people pass away. You're dealing with families. You're dealing with relatives. You're dealing with friends. And a lot of times, as you know, during the height of the pandemic, people weren't able to go to the hospital.
Mm-hmm.
You had to see your family by phone. Can you imagine losing a loved one over the phone?
Mm-hmm.
And then the nurse has to be right there with you. I've seen medical technicians that were required to take body bags out of the hospital down to the hospital morgue. In the beginning, it was very, very difficult for them to do that. Then they became immune to it. And after about a year or two of doing that, I got a knock on my door. You got to see me now. I cannot do this anymore. One day they woke up and they realized they just wasn't cut out for this. Mm-hmm. And I've had to take them off work. By the way, I take a lot of people off work. Mm-hmm. I do a lot of, like you said in my intro, I do a lot of work with stress, and I do a lot of work with people who have job issues. Mm-hmm. And I've taken out so many nurses, a few doctors, so many medical techs, so many medical assistants. And these are people that when you go to the hospital, you just expect those people to be there. I'm being humorous. Half of them are in my office. Mm-hmm. But, not quite. I don't say that many people. Mm-hmm. But you can imagine, these people are not on TV. These are not the people they show on TV. These are not the people that they interview and ask them, how do you feel about the pandemic? These are people who come in my office and cry. These are people who come into my office and complain. They don't have enough help. There are not enough nurses. There are not enough medical people. And they are totally burned out. Yeah. And I have dealt with those people all the time. And so much so that I have people just come and knock on my door. And I said to them, I'm full. I'm out for a month and a half. And you know what they tell me? Mm-hmm. I cannot wait a month and a half. You got to take me off now, or I don't know what I'm going to do. Mm-hmm. That is the sordid truth about what the pandemic has done behind the scenes. Most of us don't see that. I do. Mm-hmm. And I end up having to take them off work and explaining to the state that these people are unable to work right now. I have at least 3 nurses who have told me in the last 2 or 3 months, I cannot be a nurse anymore. I can't go back and do this.
So you mentioned stress, not just for people who are just on the job, who are not nurses and doctors. So you have just people outside the medical field who are stressed. And then you talked about lack of quality care for those people. How do we face as Black people? How do we get over those obstacles, knowing that there might be staffing issues? How do we still get quality care? How do we advocate for ourselves to still get quality care if the own medical industry needs to give their own staff quality medical care to provide it? So how do we advocate for ourselves when we know that this a lot of people who are on the front lines are dealing with this?
It's a very good question. Unfortunately, there's not a very good answer. Okay. We're short. We don't have sufficient mental health providers in the community, particularly those who are sensitive and focused in on the mental health experience of African Americans. I take that back. Many African Americans experience going to a practitioner who is not African American and being told what you're experiencing is not real. Get over it. Go back to work. And that's because the person interviewing them really is not trained sufficiently. In the field of psychology and psychiatry now, they are requiring you to take sensitivity training toward other groups of people, particularly African Americans, of course. Mm-hmm. But if it's not in your heart, you take the training so you can get credit, so you can pass the exam, so that you can be qualified, to continue treatment. But a lot of people simply don't understand the Black experience. A lot of people don't understand what it's like to live looking up at your shoelaces, you know, and we really do need more African-American providers. We need them, we need qualified and quality African-American providers. Unfortunately, it's just not available to us right now. They are not available to us right now. And quite frankly, it's very expensive to become a qualified medical health provider. You know, I know many of you've gone to, most of you've gone to college, if not all of you, and you know what it costs to go to college. And so it is a dilemma that we are trying to deal with, we're facing. Oftentimes I tell my patients, you know, I'm looking at retirement. You know what they tell me? You can't retire. If you retire, what are we going to do out here in the community? I'm thinking, I'm sure there are other people, and they're telling me, no, there are not a lot of other people. You don't understand. There are not a lot of other people, and those who are out there simply don't have the sensitivity toward the African-American experience as it has to do with mental health and health, period. I mean, there are many issues, of course, that require specific knowledge and sensitivity toward African-American experience, but health and mental health are, you know, are my area of expertise. And I can tell you that simply aren't enough people out there. I don't know what we're going to do. We keep advocating for more, and we keep asking for more. Kaiser can't keep enough of us. You know, there's constant turnover of staff there because the people are saying they're overworked, they're overbooked, and they just are having a difficult time keeping qualified mental health specialists. Well,
last question for now. Are there other resources that we can look at, given that there's limited resources from the traditional medical care industry? Is there anything else we can look at to help folks with mental health care?
Well, I would advise people, you know, who are not really overwhelmed to go online. And, you know, there are a lot of self-help advice. There's a lot of self-help advice online that can tell you some basic things you can do, you know, to deal with your problems. You know, things have been collected by mental health professionals and placed online. So, you know, if you're quick learning, you can go in there and get a lot of good ideas about, you know, how to, you know, regulate your stress, how to regulate your mental health issues. That's a substitute, but it's better than nothing. And I would advise people that if you have a PC or a laptop, you go online. If you're feeling anxious, they have some very basic things you can follow to deal with anxiety, depression. If you're really, really depressed, you really got to keep striving to get mental health services, because it's very important that depressed people are able to talk to somebody. There are hotlines for depression. I had one here and I was looking for it while you were talking, but I don't seem to be able to find it. But
would 211 be a resource for folks?
211?
It's a county, Alameda County wide.
Yeah, I guess so. But there's a number that you can call for suicide prevention if you're feeling that bad. You can call Alameda County Mental Health Services. They can direct you. They can provide you some answers. Alameda County Behavioral Health Services is what it is called.
Okay.
And they are, even if you are not going to use a service, they're required to provide you with information.
Great. Well, thank you so much. We'll come back to you when we have some questions for everyone. Okay. Next, we're going to ask Ms. Teresa Cox from Fremont City Council. She also is here representing the Black Women Organized for Political Action Black and Vax campaign. And I would love to hear just more about your experience on Fremont City Council as well, on the response to the pandemic, I know for City of Hayward, we do have a splash page of COVID-19 resources, and it includes not just things that are happening with testing, but it also includes resources for vaccinations as well as mental health. And just wanted to hear a little bit more about what Fremont's doing before we talk about Black and Vax.
Thank you. Very good question. I think one of the big things that Fremont led in the effort was that our Fremont Fire Department partnered up with one of the local businesses, which was a pharmacy, Holler's Pharmacy, located in Fremont. And basically, there was a lot of planning being involved in how to get vaccinations, how to get information out to the public. In addition to what you mentioned that we had on our website that would convey where to go for any type of COVID resources. What was the schedule? We even had Bay Area Community Health, formerly known as the Tri-City Health. They operated also a clinic for drive-through for COVID testing, as well as what was done with the Fremont Fire Department. We have an old, I shouldn't say old, it's a training center that all of our firefighters have to go through, and they extended and opened up the facility to allow for people to come in and get their shots, and also to be able to get more information on the boosters, everything in full operation. And we were advertising it through all the different social medias, through the patch, the Tri-City Voice, to reach out to the different communities there. And I think that it was a very effective program, and we were close to, I think, almost 80% that everyone has been vaccinated here in Fremont. We even had, since Fremont has a large population of Asians, that we also stepped up and worked with the Asian health providers to work out of our Human Services Department with the City of Fremont to be able to provide the shots, the information, and then putting it in the languages that would resonate if you were speaking Spanish or Chinese, or working through Indian, that we had different representatives and having that language translated as well, and having people represent that part of the community to reach out. And I think that kind of helps reduce some of the stress and getting acclimated to this whole COVID pandemic, but also working with our small businesses. Here we have the partnership of haulers and with the fire department, and also working with Bay Area Community Health, which is for predominantly a lot of our disadvantaged community goes there to get their health care, and having that accessible, as well as we had Kaiser involved, Palo Alto Medical, and of course, Washington Hospital has been spearheaded. I did a town hall with the CEO, Kimberly Hertz, and the medical officer back when COVID was still happening, the early part of March back in 2021, and having a dialogue with them and what we're going to plan to do and what was the rollout. And our Fremont Fire Chief, Curtis Jacobson, also played a part in this town hall, so we could convey the information. Then also allowing people just to keep asking questions. And I think that was the other key part, is that you need live, even if it's virtual, people. We had over 150 people that were online that were calling in, writing questions, because they had so many different scenarios of how to protect the family. And, if someone sneezes, will I catch it? So it's just addressing a lot of the public's concerns and getting that out.
Great. And can you speak to a little bit about your experience as being a frontline worker?
Sure. I did want to add in with BWAPA.
Uh-huh.
I wanted to mention with BWAPA on behalf of our president, Rita Duncan. She's actually doing a seminar in DC for cybersecurity, but on representing our organizations, which all of you that are on the phone that are women are members of, and happy to partner with all of you, is that it was a partnership with Black women organized for political action, known as BWAPA, And BWAPA's mission is to help solve the community issues besides learning about the political process. But one of the big things was to motivate us to bring forth solutions, to bring everyone together from the business side, the elected officials, and how can we continue this, what we called It's a Village kind of theme that rolled out to increase COVID-19 vaccinations. And as a result, we were able to distribute with all of our BWAPA members over 2,000 COVID informational materials in the local communities of Ashland, Castro Valley, Cherryland, and Fairview. But one of the biggest things is also was a partnership with the Alameda County Health Equity and Planning Department, because we also were pushing out through KBLX 102.9 radio station was to say, we got to get vaxxed. We got to reach out and work with the Teresa because medical clinic. We were all in these different areas that were representing people of color and trying to reach the community. But also it's important that with the distribution that we're trying to educate and have people that look like you, that they can talk the language, be able to reassure that this was safe, and providing the data, providing statistics on what can be the benefit of COVID-19. To answer your second question, Angela, about being a frontline worker during COVID, it was a rewarding experience, but a whole lot of work. And what I realized was that as a public servant, we're called to serve the community. And at any time, we have to rise to the occasion. In this case, I went in one day. Next day, I was dispatched to the field for a couple of weeks, and managing a team that I came across people from all parts of the department of the county. And we had to come together quickly as one to serve the public and distribute over 30,000 COVID test kits. I think one of the big things is that we tried to solve the issues of communication by having someone that was bilingual that spoke Spanish, another person that was Chinese could speak Chinese, Mandarin, or Cantonese. And part of this brought us all together that over the forefront, we got to be able to serve our community and serve them quickly, because we know that at times time is of essence. And we did have cases that some people said, I think I may have it, but I'm not sure, but this test kit will help me. And we worked through so many people from like 10, 12-hour shifts into the evening that we were dispersing the test kits. I think the other part that was important is we also had a partnership with Facebook and Amazon to make sure that people that got these test kits, that they weren't reselling them into the market, because we had to stop that immediately, because this is free from the taxpayers' money that was then rolled out for the benefit of the community. The other part is that it's important that we served with compassion and with love. And some people, if they didn't have appointments, we worked with them to figure out how to get them that test kit, because we knew that it could be on the verge of spreading it to other people and their family and loved ones. And so those are like the timing, the criticality. And also I was concerned, as a team, and I managed and supervised all these people, all the people that were on my team. It was also concerning to make sure they were going to be safe and at all times, because people are not thinking. And as they're going to get the test kits and how the state of my own employees working to be able to distribute them and say, distribute at a distance, whatever you feel comfortable. We all had to first make sure we were all vaccinated. That was mandatory by our county. And getting everything current, and with that, and putting in the necessary PPE and all the wares to make sure that they were going to perform their services safe. So knock on wood, nobody got sick, nobody got run over. We got all the test kits out, and we helped to make a difference, because the worry was on the people's faces. As Dr. Spivey was mentioning, it was stress. You could see the stress. You could see that they were totally consumed with getting that test kit. And it was a matter of life and death in some cases. So I really appreciated the opportunity, and it took me back from being at a desk to being in the community and community engaged to really see it firsthand.
Thank you. Thank you for sharing your experience. And we'll come back to you for questions for everyone as well. Next, we're going to go to LK Monroe. And will you speak about some of the challenges you have faced when considering and creating policies amidst the pandemic?
Yes, thank you. So there have been many. One of the chief considerations is the fact that the conditions or the trajectory of the pandemic continue to change. So we were in one reality to begin with. We laugh now at the county office and in school districts to say, remember when we thought this was going to be a couple of months, we'd go home, everybody would stay safe, and then we'd be back. And here we are 2 years later, and we have in some ways just said we have to be flexible and adapt to this as it comes, because there's a lot of it that we can't predict. So policy has been like that. I am currently serving as the president of the organization of 58 county superintendents for the state of California. So that's where I have that view of how communities are dealing with this across the state. So there's our communities, which are, largely urban, occupied by folks of color, and certainly the folks of color who are most impacted by this, and Black families are at the top of that list as being severely impacted by COVID, to seeing rural counties who have their own issues, of Dr. Spivey talking about depression, substance abuse and generational substance abuse, and then not being able to connect to the internet. So when we were looking at policy issues, it was that kind of breadth of reality. When we're looking at it in Alameda County specifically, we work with our public health department, and that is one, I think, really positive thing that's come out of the pandemic is, we would talk to public health from time to time as issues arose. We are on the phone, multiple times a week now, and we host meetings every week, either for the superintendents or for all educational leaders and school board presidents throughout the county. So in terms of policy making there, Dr. Nick Moss, who is the public health officer, and I try to talk ahead of time before messages are released to assess what their impact to the schools will be, because it's different for the schools than for other sectors. There's particular impacts on the medical sector, particular impacts on other businesses, but schools are unique as they have children and parents who need to work. So it is, the policymaking exercise for COVID has been, it's needed to be rapid response. We've needed to put policies in place that we may never use again. They just needed to respond to the moment.
And we do have a question in the chat for you. What resources are available to schools from the County Office of Education to address the stress students are facing in school and home situations?
Yeah, that's a great question. So during the pandemic, one of the things that I was able to do was to start a social emotional learning department. Not ideal to start things during a pandemic, but this was one of those things that had to happen during the pandemic. And we are working with multiple school districts to help them stand up their social emotional supports. Strange thing, I guess you could call it another silver lining, but strange thing that happened during the pandemic is somehow people awoke to the fact that children need mental health supports, that children need social emotional support, that children are fully thinking, feeling human beings and not just receptacles for information. So you can tell I'm a little passionate about this one because it's something that it's a drum I've been beating for years. And, it's always been, oh, there's not enough money for that. So we made sure that we were leading for and holding the knowledge around social emotional learning. Some of our districts have already done some deep work on this. Some of them are just beginning because they haven't had the resources, both financial and human resources, to go down that path. So we are in real time providing grant funds for schools. We are providing people to come out to train and to help assist. Something that I am really also passionate about is the nexus between how we take care of the social emotional needs of our students and school climate and culture. We will not be able to, and this is another thing Dr. Spivey spoke to, we will not be able to fully staff our schools with mental health professionals. There just are not enough of them. And particularly now that there's COVID money in the system and everybody is looking for the same type of training from people, we have to train as school communities. So some of those first line things like low-level anxiety, low-level depression, dealing with particular incidences, our school communities can be better trained to really spot those and to intervene for those before a student needs to see a mental health professional. And so those are just some of them. I would be happy. Did Ms. Boyd ask this question? I would be happy to provide her with more information if she would like it.
Great. And what are the concerns about the educational levels and graduation rates of students, especially students of color, because of the challenges stemming from COVID-19?
Sure, there are many. I will just say honestly, there were many before the pandemic. We know particularly our Black children are not graduating at the same rate as their peers. There has been great improvement over the years in that, but the pandemic has definitely led to a setback in that there have been students that have become disengaged from school. So during virtual learning, there were families that found it difficult to support their children in a virtual environment. There are families, particularly for kids who are in high school, where there was a more immediate need for kids to work and contribute to the family, and were not attending school. So many districts have done deep work to try to connect with those families, reconnect them to school, and it's not been easy. Now that we are back in school, I think there are greater efforts to make sure that we're mitigating for some of that loss, but it will take years, quite honestly, to be able to mitigate for the losses our students are experiencing, because the losses are not just academic. Things like, isolation, things like for our youngest learners, really those, the younger you are, the more a year means, and we're talking 2 years. So if you had a 3-year-old who was about to go to preschool, maybe leave home daycare and go to a preschool, they didn't get to do that. They lost that opportunity, and now maybe are going straight into kindergarten. That's huge developmentally for those students. So it's something that we are talking about. We're convening educational leaders to really talk about the best strategies that are being elevated to help accelerate learning at all throughout the age spectrum. So.
Yes, that's so tough. I have a 3-year-old, and I've had to put her in daycare, and it's terrifying because the kids don't keep their mask on because they're 3-year-olds.
Right.
But it was so important developmentally for her to go, because we could already see, looking at what the normal projection is of how children are and how they progress, and she wasn't there because she was at home and not amongst her peers. So I could see that being very challenging for people, especially if they have kids that are older, how that could be challenging for folks. So thank you for that. Well, I do want to ask a couple of questions for everyone before we move on to our keynote speaker, but we do have one question for Dr. Spivey. Can you recommend websites, recommend websites to prevent going to the wrong site? It sounds like we probably want additional resources. So if you have, this question might have been asked before you listed some, but are there any other websites that you would like to mention before we move on to questions for everyone?
I don't have a lot of websites at hand right now. MD.com, I think, is one. There really aren't a lot of websites per se that address mental health issues. MD.com, I think, is a very good one.
Okay.
When Dr. Noir comes on, medical and mental health are often they cross paths, and maybe he would have some at hand that he
Okay.
could recommend.
Great.
I didn't come prepared with specific websites. I'm sorry.
Great, no problem.
Okay.
Well, you definitely mentioned some earlier, and then we'll definitely put md.com in the chat for everyone to look up.
But if you go to Alameda County Behavioral Services, they should be able to give you some answers. That is a hot spot for answers in terms of where you might be able to get mental. They may not be able to serve you because it's basically a Medi-Cal-based Alameda Alliance-based service, but they're supposed to have the information.
Great. Well, thank you. So I have one question for everyone. We'll start with you, Dr. Spivey. What are some of the unforeseen challenges you experienced in your professional capacity during COVID?
I didn't expect this intensity. Like I guess it was Ms. Monroe that mentioned, we thought this was going to be a couple of months, maybe 6, and then we'd be back to normal. I didn't expect the intensity of the need of services by this population that was affected. It just knocked my socks off. And let me add one other thing. There are 2 things I like to add, but one is that we talked about children. Ms. Monroe talked about children in the school and what their special needs are. I don't see a lot of children, but can you imagine now, as adults, we can figure this out. And I use the example, like if you're on a long flight to Europe and you get on there, you're all happy. Oh, okay, we got this, we got this. In the beginning, we weren't happy, but we got this. And then after about 3 hours in the air, you start getting fidgety. Oh, gee, it's time for us to get off, and my legs are tight. I'm tired of walking up and down the hallway. I mean, the hallway. Then after 5 hours, you're irritated. So if we as adults who've been through things like this before, of course we haven't been through a pandemic like this, not those our age. Can you imagine what a child is thinking of? When is this going to end, mommy? When is it going to end, daddy? And I have grandchildren, and they don't know what the heck's going on. So yes, it's having an impact on us, but we have to understand we have the broad sense of experience to understand at some point this is going to back off, and we can reach some normalcy. A child doesn't know when this is going to end. So we have to be there for our children and understand whatever anxieties they are exhibiting, and try to coax them. Right. The other thing I wanted to mention, and I know I don't want to hog the time, and that it has to do with the suicide that has gone up. Among general population, it didn't go up. It almost reached double in the Black youth community. And we need to understand what that's all about. I understand it's about socialization, but what else is going on that our suicide rate among Black youth doubled? And that is something we really are going to need to research and come up with some answers.
Thank you. And I'll just mention that, again, the suicide prevention line is available. You can go to 1-800-273-8255. That is also 273-TALK. So we'll also put that in the chat for folks. And thank you. That's heartbreaking to hear. Okay, you mentioned you didn't expect and I don't think anyone really expected the duration. You thought it was a few months, now it's a few years. Is there something else that was unforeseen with this pandemic for you?
All of it. Truly. I mean, we've never been through anything like this. We haven't. And so as, I'll just say leaders, I think, because that's a hat we all wear, but particularly as educational leaders, we're used to looking at a problem, making a plan, and executing that plan. Now, we're not saying it doesn't change, because, we're dealing with children and people and all of that. So it does change, but we understand kind of, okay, this could happen, that could happen. We didn't know with this at all what was going to happen. And really, I'll speak for myself. I started out thinking I knew, oh, this will last this long, and then we'll go back to school. And yes, it'll be difficult for a while. People will wear masks. We'll have to figure that out. There'll be distancing, but then that'll subside, and then we'll get to here. Delta, Omicron, the testing protocols needing to change, just everything changing. Communities protesting against masks, some saying masks needed to be, worn continuously. It was just, one of the things that we have seen just in terms of staffing, you've heard in the news this term, the Great Resignation. It's real. It's real. And if you're a superintendent, if you're a principal, if you're a teacher, if you're anywhere near retirement, you're thinking hard about retirement, or you're doing it. We have a system, the state teachers retirement system is seeing an unprecedented, there's a term we use a lot, number of retirements, because it has taken such a toll on folks. And I think it would be different if you could say, okay, this is going to last 2 more months, like, hang on, we'll get this under control and it'll be fine. People know that it's going to take years to recover from this, and that we'll always be living with COVID in some way. It may eventually be like the flu, but right now we're going to be living with it in some way. We're going to need to be ready to put masks on again if there's another surge. We just don't know. So all of that was unexpected. And I'll just say, in the midst of it, we tried to make some things predictable, like the availability of vaccine, the availability of testing, trying to make those things easier so that all the things that you can't control, people could focus on those.
And that's an important point that you bring up. You should definitely check out your city webpage to see availability of testing centers that are near you. I know Palmacia Baptist Church has hosted a lot of vaccine or testing clinics. And yes, the Great Resignation is real. It kind of speaks to what Dr. Spivey is also talking about, where people are, it's difficult for them to stay in the medical industry during this time. So those are really important points. Teresa, what's something that you thought was unforeseen during this time?
Well, I think one of the things, in addition to what's being said, it created a staffing shortage. And in terms of how to carry out the city or the county services with less people, because as soon as one exposure led to another, and then someone else is out for a couple of weeks coming back. And additionally, you see people retiring. There's created a huge vacancy that a lot of agencies across county lines and city lines are seeing a high number of how to keep up with recruiting, retaining, and hiring at a faster rate. And that does impact the services to the community, whether it's, for parks and services cleanup, homeless encampment cleanup. Yep. We can't get to it faster. And it's led to a lot of things that, unfortunately, with the homelessness and the higher cost of living, you see a lot more homelessness and the encampments. And it's not just cleaning at one time, it's caused multiple times, and related to some of it related to substance or mental health. Then when you look at the business side of things also, that you're not having enough deliveries happening. The food prices are going up, gas prices are going up. And then it's always the question, when do you bring people back to work? And right now our city council meetings are still virtual. And we have not decided yet to when that will occur, that will be back in person, and whether we'll have the plexiglass around each council member to protect each other. Those things are still being worked on as we speak. Another thing is that the whole material shortage is how long it takes to get products, whether you're talking about tires or cars, or even just standard food to supply to the jails in different counties. You're seeing like the chain of impact, that it's like driving at 4, 5, 6 months out to get a stabilized flow of supply of food, for example. And the food vendors are not willing to accept anything past a 3-month window, because the other 3 months, they can't guarantee the pricing. They can't agree if they're going to even have the availability to bring it in and deliver the products. One of the things that I saw, since I have a public service role day by day with the county, I oversee 125 county buildings, and as well as 3 county hospitals. One of the biggest things also was how many ventilators and oxygen machines we're going to be ordering, and how to keep the supply of that oxygen bought in these cylinders, maintaining a continuity to keep people alive during this pandemic. And even though it goes up and down, you still got to have an emergency supply. You still got to have the wherewithal. We even brought on a hospital that was defunct for 10 years. And to respond to the COVID, we had to open a building that would starting all over again. And you can imagine having to move patients around in all the different areas to address that. So there's a lot of things that the cost of living, the cost of the goods, it's like 35-40% more than what we paid a year ago, which is eating away the budget of the taxpayers' money to be able to provide those services. So it's still, we're still going to live through it. And it's not like it's going away, as we all have realized now. The impact of even where we were before is a couple of years behind to get back to the normal state. And so those are the challenges that we're going to still have to manage, and providing the services to our community. And we're going to have to reset priorities to be able to address those.
Well, thank you all for the responses to your questions, and to the panelists and the audience for submitting your questions. We will have another question for everyone at the end, but next I'm going to introduce Dr. Michael Noir. Dr. Michael Noir is an allergist and a pediatrician who has practiced pediatrics and clinical allergy full-time since 1977. He is board certified and a fellow of both the American Academy of Pediatrics and the American Academy of Allergy, Asthma, and Immunology. In 2014, was elected and served as the 114th president of the National Medical Association. For 20 years, Dr. Noir worked as the director of allergy services at San Francisco General Hospital. He also served as the chair of the Underserved Committee of the American Academy of the American Academy of Allergy, Asthma, and Immunology. And he was the president of the Northern California Allergy Association and the chair of the National Medical Association's Allergy and Asthma, and was awarded the Meritorious Service Award from the National Medical Association in 2014. He founded a nonprofit, African American Wellness Project, more than a decade ago to address health disparities in the Black community, and his organization is committed to informing minorities about how to advocate for and take charge of their own health. Through the years, AAWP has served as a trusted megaphone in the Black community, and recently launched a podcast, Black Doctors Speak, and a Facebook Live program called Wellness Watch. He's also hosted and executive produced the About Health program, a 1-hour talk show on Pacifica Radio, KPFA. His popular 1-minute feature About Health Time currently airs several times per week on KBLX in the 9 Bay Area counties. He also served as the executive producer of the video clinical trials in the African American community, which won top honors from 1,100 entries in the Health Video Awards in 2005, and was a finalist in the Community Service Video category, International Health and Video Awards in 2006. He is married to Denise Washington, who holds a master's in nursing and is a family nurse practitioner. He has 4 daughters, 5 grandchildren, and 1 great-grandson. I don't believe that. I don't believe that at all. He is a lifetime member of the NAACP Alpha Phi Alpha fraternity and holds memberships in the Sigma Pi Phi fraternity. Thank you for joining us.
Thank you. Thank you for having me. And let me first apologize for being late. One of the roles that I served, that was more like an obituary than a biography. I don't know where you got that one from. I've got a 2-paragraph introduction I thought I sent to you, but I appreciate the opportunity. What I really appreciate, the reason I was late is one of my most important responsibilities as a grandfather. And my granddaughter was coming back from her first lone trip as a 13-year-old, and she was arriving at Oakland Airport, and she was late. So but I do appreciate this opportunity. It was unique for me because I am operating in a whole different silo from the rest of you. And I had no idea of all of the challenges that you're facing and all of the things that you've had to do. Dr. Spivey and I have practiced in the same building for the last 25 years, and I have never had a chance to talk to him because he's always so busy, just as he says. But this has been a great opportunity for me to understand all the other fallouts of the pandemic. I'm among the doctors probably most uniquely qualified to understand this pandemic from a medical perspective. I'm trained as an immunologist as well as an allergist and pediatrician. And when I first heard the first descriptions of what was going on here, I knew what was going to happen. I didn't have any doubt whatsoever this was going to be a nationwide pandemic. It was going to be dangerous, and African Americans were going to be the most at risk. And while there are other ethnic groups are also at risk, I'm going to focus a little bit on what happened to African Americans and why it happened. First of all, I'm not surprised that our death rates were much higher. We're the people who caught the early bus. Nobody told us about this pandemic. I mean, we were driving buses, we were cleaning nursing homes, we were janitors, we were right in the face of this infection. And so when it happened, I knew immediately that African Americans were going to be most at risk. CNN and MSNBC and even Fox, they sounded shocked. But as Black doctors, we knew what was going to happen. And we knew it was going to happen for a number of reasons. One is that we were exposed, overexposed. Secondly was that we were already sick. I mean, if you look at the statistics on African Americans, from the cradle to the grave, for 400 years, we have been sicker than the rest of America. And so consequently with this whole issue with George Floyd, has started, everybody starts talking about equity, health equity, legal equity, all the equities. We've been talking about equities for a long time. And so consequently, that's one of the situations that we really expected. We knew African Americans were going to die more often. And consequently, because there are a couple of things around the situation as it exists, not only for those people most at risk, but for African Americans, regardless of the socioeconomic status. And there are 2 things that impact us differently. One is health disparities, and the other is healthcare disparities. Health disparities you're more familiar with. Those are the kinds of things that we get that are different. Diabetes, hypertension, asthma, those are diseases. But those diseases are stimulated by what we call healthcare disparities. And that is the way we are treated, regardless of your position, when you're Black and you enter the healthcare system. And those 2 dynamics. Now, I'm one of those doctors, I've been out every day since the pandemic started. I mean, I did some telehealth, but because Denise was not going to let that virus get in our household. She was not going to let that virus do anything. She never left the house. But I left the house every day to go to the hospital, go to nurseries, to go to other places. So I got a chance to see a lot of things. But even before that, when we founded the African American Wellness Project, it was because the way you're treated when you enter the healthcare system, whether you have a PhD or a prison record, is very different from the way other people are treated. And two dynamics play into that. One is the fact that we do our share of not going to the doctor early enough. If you look at all the statistics on cancer and diabetes and asthma, for instance, just take asthma. African-American women have the highest mortality rates from asthma, perinatal mortality. In the pandemic, African-American pregnant women died 2.9 times more than other ethnic groups. A lot of it had to do with how we enter the system and when we enter. For prostate cancer, for breast cancer, for diabetes, for asthma, we go too late, and especially for Black men. Black men are the only demographic in our society whose health is no better because of your socioeconomic status. So we just don't go. But that's one thing. But the more important dynamic is what we call unconscious bias on the part of the system. How the system looks at you as a Black person determines to a large extent how you're treated. There is that tragic video of that doctor, that Black doctor. Many of you probably saw it. She was in the ICU, intensive care. She was filming from the ICU. She was getting no care at all, even though she was a Black doctor. And when you enter the healthcare system, there is an unconscious bias on the part of the system itself and also on the part of other people. So we talk about, and I flow right into hesitancy. Why are we not getting this vaccine the way we should? Well, of course, people will yell about Tuskegee. Most of these young people don't even know about Tuskegee. I ask them about Tuskegee, half of them didn't even pass science. Yet they have all these views. But what happened? What happened? A health system which never extended itself to our community comes to you and tells you to take a vaccine, which is questionable, which is controversial, and which a lot of other people are not taking, and expect you to trust them. They've done nothing to earn your trust as a community. They've done nothing to earn your trust in any other way. So that's one thing, the whole issue of trust, because I'm dealing right now with trying to get people vaccinated. And I'm skipping around a little bit, but I go back to the days before these vaccines when I would see 60 to 70 to 80 patients in my office a day. Now, if we see 25, that's a big day because of vaccines. I saw polio, I saw meningitis, I saw pneumonia, I saw all of that. So the memory, institutional memory is not great for that because now we give 14 vaccines or 15 vaccines to children, and all of those children are no longer in our offices. So trying to get children vaccinated now for this COVID vaccine seems to be a much bigger challenge. And the other thing that happens when we go into that system is a measure of disrespect. We are not respected by the system. I could go around these 38 people who are on this call, and each of you would have one story where you try to get some information, you try to get the doctor to call you back, you try to get the kinds of services that you were entitled to, and had to fight like crazy, whether you were superintendent of schools or whether you were just janitors. If you're Black, you have that same problem. And I go back to when I was about 10. My mother and I went to a clinic. We lived in a lot of different places. My dad was a YMCA executive. We moved. He ended up running the Harlem Y in New York. So we went a lot of places. We were in this big clinic, and there were white people there, there were Black people. This was probably like in the late 50s, or maybe early 60s. And so the doctor went around, and this is just a microcosm of what we face. He went around with a clipboard, and he said, Mrs. Golden, Mrs. Smith, Mrs. Johnson, and then he said, Terry. And my mother's name is Terry, and she didn't move. And then she said, Terry again. And, I said, Mom, I'm 10, I'm a little embarrassed when all these people looking at us. And she said, Terry, and finally everybody kind of looked at her because she was the only one left who could have been Terry. And he said, Terry, why didn't you respond? She said, I did not give you permission to call me by my first name. And that was my mother. She also said same thing to a cop in the middle of Smoky Mountains in the middle of the night, which is a whole different story. But what that suggested is that the system does not automatically respect you. So to kind of bring it back to what I'm challenged with, because I've heard what your challenge is, and I'm so grateful to have heard all of the things that you have had to do just to keep this stuff going. I'm challenged with vaccinating people, vaccinating children, because pretty soon there's going to be a recommendation that children between the ages of 2 and 6 months get vaccinated. And our statistics are terrible and they align with our death statistics. We're twice as likely to die from COVID as other ethnic groups. And so consequently, my challenge is to try to overcome this whole situation. So what is my strategy? What is the strategy of the African American Wellness Project? We believe, and I believe, that health equity improves for African Americans when we start from the bottom up. I often say that if you got as mad with healthcare that's poor in quality and disrespectful and unequal as you do when somebody cuts in front of you in the Safeway line, we wouldn't have this problem, because you would demand of that system that it respond immediately, like we don't demand in healthcare. Our position of our organization is that you have to start your health system from the bottom up. You got to know some things. You got to go some places to get your proper screening. You got to demand information. You got to ask the doctor who he is and what he knows. You got to pick out your own people. You don't know whether a second opinion is being referred by somebody's brother or because somebody, just happens to like somebody else. You've got to build your own healthcare system. And that involves basically two dynamics. One is navigation. You got to know how to navigate the system, and you got to know how to use it. Whether you're in Kaiser, Medi-Cal, or Blue Cross, or Stanford, or UCSF, you have to know the system. The second thing is you have to advocate. You have to have an advocate or be an advocate for your family. Because if you don't have an advocate now and you go into the healthcare system, you don't know what's going to happen. And that advocate can't be your brother because he likes coming up there. It has to be somebody with some healthcare knowledge. It can help you if you need to make some statements to get the kind of care that you need. And so we're fighting an uphill battle on two fronts. One is we're trying to help African Americans develop system. If you go on our website, we were gifted because of the health equity. And I know every one of us knows this equity thing gonna run out in about 3 or 4 months. We're gonna go back to the same struggle we've always had. Right now, we're kind of hot for a minute, but in about 6 months, all the equity money is gonna be gone. Everybody's concerned about us, that's gonna be gone. We know that already. So you have to develop your own system. And you also have to have an advocate to get through that system. But we're focused on giving you that information. On our website, we were gifted through equity, as I go back, something called HealthWise. It's a $40,000 platform you can go on, type in your symptom. It's all vetted, and you can look up your information on a variety of different healthcare systems. But so that's one thing. The other thing is that you have to demand of the system that you get the kind of healthcare, not only for you, but for everybody in your community, Black or white, because nobody's happy with the system. But our struggle right now is we know one thing: vaccination saves lives. It may not keep you out of the hospital. It may even not keep you out of the ICU, but you're less likely to die at a 99% level. So we're going to be here long after the equity money is gone. We're going to be trying and talking to people about how these vaccines work. We're going to continue to listen to to much of the stuff, but unlike Dr. Spivey, I mean, how much information do you need before you can make a good decision? And so I'm tempted as a doctor to be a little bit more aggressive about getting people vaccinated and talking to them about vaccinations. But at the same time, I do understand the concept of hesitancy. And as we move forward, this is not the last variant, believe me. There are going to be other variants. These variants know how to preserve themselves. They've been here the longest in terms of evolution. They know how to make a virus that's going to do something against one of these vaccines. But I think we're ahead of the game scientifically. So we know there are going to be other pandemics, but are we going to be ready for the social pandemics I've had to deal with around hesitancy? You've had to deal around education. Other people have had to deal around economics and organizational strategies from people who are in positions of responsibility. If we as doctors don't start now to build trust and to be in, and that doesn't mean just seeing you when you come in for your visits, but getting out there in the community, trying to meet and greet and be involved in the community. I'm not just talking about doctors of other color. I'm talking about Black doctors. And when I first started, there were 75 Black doctors in practice in Oakland. Now there are 4 or 5, maybe 6, because of the systems, the way we've allowed the systems to develop. But in any event, we as doctors have to get out there and earn your trust. And we don't earn the trust of the communities most at risk in this pandemic, we'll have the same problem in the next pandemic.
Thank you, Dr. Noir. That is so true. When I was pregnant, a lot of the statistics were coming out about African-American women, and the mortality rates during pregnancy and giving birth were high for our population. And I was fortunate enough to have pretty good medical care, but I definitely understand the microaggressions that happen against Black people in the medical industry, where it's I experienced it just going to the pharmacist and having those like negative interactions going to the pharmacy. You might have a negative interaction when you're getting your checkup. And so when those things happen, it's not so easy to just change your insurance company and go somewhere else. So what are some of the things that we can do to be an advocate for ourselves when we're kind of in the moment of experiencing those interactions?
I'll tell you 2 stories. I think the first thing you can do, most important choice you have to make is your primary care doctor. Mm-hmm. Now you got to choose somebody that you think will be your advocate and will be the kind of person you want to interact with. Too often we're assigned these doctors and you think, well, I can't change doctors. Yes, you can. You change doctors just by making a phone call. And so, I mean, in the early days, we used to have a program, the old KDIA, where it was called Medical Update, and we talked to people all the time. And this one person still sticks with me. He was an older gentleman who had heart problems, and he couldn't get, he came to Kaiser, he couldn't get UCSF, I can't remember, he couldn't get services. And he said, "Go over there, doctor, they don't talk to me, I can't get in, they want to push me off." I said, you go over there, and you go in that lobby, and you act Black. You just get loud and crazy, and you start yelling, screaming, you're not going to put up with it anymore. And the next week he comes, "Doctor, I'm at UC right now. They're prepping me for cardiac surgery." I mean, you cannot allow the health system to take advantage of you because it's a health system. But your most important choice is your primary care doctor or nurse. Or nurse practitioner. You go in and you interview them. You ask them a series of questions before you select them as your primary care doctor. I don't know any system that forces you to take a particular primary care doctor. Now, you may have to see somebody on an emergency basis like that, but you have to pick, and this is not just for African Americans, it's everybody listening to this program. You have to pick your primary care doctor carefully. And once you get that decision made, will he call you back? Is he available? All of the things that you want, then you have an opportunity to change your system. And then when you go in there to your visit, be organized to express your concerns. Have it on a piece of paper, write something down, and ask questions. Doctors are often intimidated if you go in there asking questions. But if they go over the line, you say, well, you say, well, I don't know what's wrong with you. I said, well, what were you thinking about before you didn't know what was wrong? There are all kinds of things that you have to be organized to do. And that's what we have on our site. Dr. Glenda Newell Harris wrote a book called Focus on Your Best Health, which is one of the best books I've ever read on how you deal with the system. But you've got to pick your primary care doctor. That's the very first thing that's important in terms of changing the dynamic for your healthcare.
Great. Thank you. So the last question I'm going to ask, and I'll start with you, Dr. Noir, is what are the necessary resources we need to have our best foot forward. So you talked about picking our primary care doctor. You talked about making sure we're organized. What are some other resources we should have that you would like to add on?
Yeah, I think Dr. Glenda Newell's book, Harris' book on Focus on Your Best Health. It's available on Amazon. She wrote it with Dr. Brenda Spriggs. It is the single best book I have ever read on how you go about all of this. On the African American Wellness Project, we focus on a number of things. We focus on giving you information. Every week we have the Wellness Watch, we have a podcast on different situations. We give you the opportunity to ask questions. We do traditional media with KBLX and KD. And so we're just trying to get you to focus on the issues that might come up in your life and early detection, recognizing symptoms. Picking your physician is critical, and asking questions. Don't let them send you to some specialist you don't know anything about. Look them up online. Yelp got a lot of things. I got even some bad reviews, but I could have written some reviews about them. You can't respond on those things. I wish I could have responded, but in any event, make sure that the people they send you to are, and then you have to know what screens you need to get. You need to know about colon cancer being moved up 5 years. So people over the age of 40 need to be screened. You need to know about when to go for prostate exams and what the exams are and what the options are so that you're getting the best. Breast cancer, you look at all the statistics on breast cancer, nothing to do with genetics. The Black women carry the burden of cancer, and all types of cancer. But it's because we ignore symptoms and we go too late. And so consequently, those are the kinds of things. But I think for one resource, I think Glenda Newell Harris's book is the best.
Great, thank you. Next, we'll go to Dr. Spivey. So the question is, what resources are necessary to move forward on the best foot?
Resources as far as mental health services?
Yes, you talked about if there's anything else you would like to add. I know you gave a lot of resources about the Alameda County Behavioral Health and
Yes,
the suicide prevention. Are there any books you recommend reading, any self-care practices that you could recommend for people during this time to help manage their stress possibly?
Well, I advocated going on webmd.com. You get a lot of information from there, a lot of resources. There are a lot of resources in general health and also in mental health, any kind of health. And I would suggest that that's where I go oftentimes when I'm stumped. And, if I want to look at additional information on a certain diagnosis, I'll go online.
We want you to go to aawellnessproject.org.
What is it?
Yeah, we want you to go to aawellnessproject.org the next time you have something wrong. Walk downstairs.
Okay. Well, yeah. I'm sorry. I pulled this together in the last couple of days, and I didn't pull in the resources which I should have come equipped with, and I will next time for sure.
That's okay. They just shared the aawellnessproject.org, so we're all good now.
Okay, good. Thank you, Dr. Lenore.
All right.
I see you in the parking lot. I'll thank you.
All right. Next, we'll go to Teresa Cox. What are resources you feel are necessary to move forward?
Well, I think for one, we do have a City of Fremont website. And in addition to the health equalities that we're trying to address, we do have a www.fremont.gov. And at the very top is a click on that they put in red, so you can't miss it, saying the COVID-19 virus, and you click on it. And it's going to deal with multiple things, whether you need testing centers, go to a provider to get your shots, and the schedules, the locations. And additionally, we also have reached out, and we had gotten some federal funding for those that had lost their jobs and they're not able to make payment for their rent. And so they have rent assistance that's also addressed, and even small businesses where they can apply to get some help there. And additionally, just passed, I think in just last 2 weeks, was the assembly bill that addressed the retroactive pay for COVID workers that had lost days of work, and they're going to get reinstated their pay, providing they had the symptoms and providing, or either they were providing, helping loved ones out. And so that's a big help, because that starts between January back pay all the way till September 30th, 2022. So all those things are kind of listed on our website, and how people can take advantage of that.
Thank you. And then we'll go to LK.
Okay, it took me a minute to get off mute there. So several resources that we both need and that we provide. One of them, and this is one of the things that our council member spoke to, which is human resources. Staffing is at all-time low levels. One of the things that we have done is we repurposed people from our county office and put them in classrooms. We just said that we asked our districts what they needed. The thing they needed was subs. And so we went into classrooms and just covered for subs. The great thing that it did was show us what classrooms and schools need firsthand, not just what we were hearing. We've seen some classrooms where they've been without a sub for weeks on end. So that is a huge need and a resource we've been providing temporarily. And in the long term, we also have a College of Education where we are recruiting particularly teachers of color to come into the workforce, because even before COVID, people weren't choosing education as a profession. So and it was exacerbated by the pandemic. So the other thing is, this is what Dr. Noir talked about, which is vaccination. In order for us to make sure that schools stay safe places for young people and the workforce to be, we need vaccination at higher rates. I had some numbers, if you'd like it, around Black student vaccination rates. Or Black community vaccination rates. These are from Alameda County. So overall, we're at, in Alameda County, almost 83% in terms of vaccination for for the Black population, that's 67%. So, it goes from 83 to 67. And then from 12 to 17-year-olds, we have 50% of 12 to 17-year-olds having been fully vaccinated. And for 5 to 11, we're only at 24% vaccination. So we have talked all the way along what we call, how public health calls, the state of California calls healthy place index neighborhoods, places where we know that vaccination is much lower than others. And we've been prioritizing that for certain schools. Oakland has done a great job of that. We've been providing vaccination resources in our area of Hayward, which is one of those areas. So that is another resource. We have to keep pushing that. And, we're at a time where it's by any means necessary. So we've partnered with Safeway to give people gift cards. We've made sure that it is very easy for wherever people are to get these vaccinations. We need to go to the community, making sure that the mobile units are targeting community members. And then there's trusted ambassadors in school communities who really can talk to parent to parent, peer to peer about why it's essential. Just to give you an indication, we have had 3 teachers in our small school district in Alameda County who have lost a parent. 2 of them lost both their parents to COVID. And it's been devastating, and in some cases decimating to families. So those are just a few. Again, I put the website in the chat. If you're looking at schools, all the school COVID resources can be, you can find them there.
Thank you for mentioning that, I mean, I have family members that we've lost to this, and I know people are getting a little bit more casual with this, and we have to remember this disease is still impacting families, and there are still fatalities from this disease. So thank you for sharing those stories, because I do feel like people think, oh, we have the vaccinations out there. It's Omicron is not as deadly, and it's definitely not the case. We still have this pandemic is ongoing. So thank you for mentioning that. Dr. Noir, we do have a question for you in the chat. Do you have any suggestions on how we can reduce the stigma of receiving mental health support? I know Dr. Spivey talked about it earlier, but do you have suggestions on that as well?
Well, I think we just have to keep talking about it. I think one of the hardest things for us to overcome is the word crazy, because we assign it to every single mental health problem, be it minor or major. And so consequently, it makes people reluctant to go seek care. I think the bigger problem, I think younger people are more acceptable to that, but what Dr. Spivey says is correct. Both in medicine and in mental health professionals, we have very few African Americans. I mean, to see people. And obviously cultural sensitivity and understanding of literacy. And I remember when I first went into medical school, the University of Texas, they had, of course, all the patients that they used as examples of bad disease were Black. But they asked an older lady what she had, and she said she had the miseries. Well, I knew what the miseries were. You know what I mean? That was a common diagnosis, but it stumped the academic community. And so consequently, we do need people of color. We need for the whole system to be more sensitive. But our bigger problem is we need young people to go into the area of mental health because we just don't have enough people.
Well, thank you. Thank you all for joining us today. Really appreciate your time. You gave a lot of good information and resources. I just want to let you all know that the Hayward Area Historical Society will have a recording of this panel discussion on their YouTube channel. So definitely check that out. And I also want to thank Caroline Sandoval for organizing this event. I know it was a lot of hard work. I also want to thank the Links and Palmacia Baptist Church for helping with questions and organizing this event and invitations and all that. So thank you so much. And we hope that you all have a great Sunday. Stay safe. I know there's mixed messages on masks. If you want to wear that mask, you wear that mask. So please continue to stay safe, wash your hands, and keep your families close, and tell them you love them, and make sure you stay connected with everyone. So thank you all so much. Take care.